Has your neck or back been injured? And have you been told that you should be better in a few days to a few weeks and you're not? This is rather common. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and I'm fellowship trained in primary spine care. Please remember these videos are for informational and educational purposes only. They are not a substitute for chiropractic or medical advice, for diagnosis, or for treatment. So let's talk about this idea of spraining your back. Back sprains commonly occur with athletic injuries, slips and falls, work injuries, motor vehicle crashes. And most patients and sometimes a lot of doctors, unfortunately, assume that all sprains are the same. But the reality is that a sprain actually has three grades. There's grade 1, grade 2, and grade 3. And this is diagnosed with a history, a physical exam, and oftentimes you're going to need imaging to confirm it one way or another. So let's talk about these three grades briefly. So a grade 1 sprain is where there's tenderness in the area, there's restricted motion, and there's been some injury to the ligaments on the inside. Now, I've got a demo that I want to show you here. The ligaments are the connective tissue that hold your bones together. So for example, we oftentimes hear about athletes that might injure their knee and they have an ACL injury. Well, that stands for anterior cruciate ligament. Well, we have ligaments in our spines also, and these ligaments are straps. So I have right here a piece of silly putty. All right, we used to play with this as children. Now, silly putty has got characteristics that are very similar to human ligaments. If you go very slow, the tissues will stay intact. These tissues that make up ligaments, they can handle low load, repetitive load, and they can do it for a good period of time. However, when they are violently stretched, different things happen. So if you take the same piece of silly putty and you pull it real fast, you can see how it can snap. So a quick jerk can actually tear the tissues. So injury is totally different than exercise that is deliberate, controlled, and when working out. Now, if we go back to this analogy of tearing tissues or pulling them like this, what can end up happening is you have several different types of injury. So the first one, a grade 1, that's where you take these tissues and where they're pulled. They're stretched beyond what they can handle. There is some internal tissue disruption. It's usually considered to be, in the research literature, about 10% of the fibers are damaged. There's swelling, there's inflammation, and on imaging, there seems to be no change in the joint surfaces. Because remember, ligaments hold bones together, so the joint surfaces should be intact. Grade 2. Grade 2 is like what I just showed you before, where you pull it apart and now the tissues are deformed. So grade 2 is partial thickness tearing. There's more tearing within the ligament tissues. The ligament might still, I'll show you here, the ligament might still be intact, but this is rather sloppy. And it's going to behave as if there is not much support in there. So a grade 2 injury, you can sometimes see the joints that are being held together, the joints have widened. So it's called joint space widening, or else you load the joint with a stress view and the joints start to separate in a direction and in a magnitude that they're not supposed to. Now, grade 3 was the first one that I showed you. Grade 3 is this one. This is a full thickness tear. So grade 3, that's where, for example, in the knee, where they would go in and they would totally replace the ligament, where you would have a brand new ACL or anterior cruciate ligament that is put in with an injured knee. In the spine, a grade 3 injury can be somewhat catastrophic depending on where it's at. However, once again, you have to remember an appropriate exam will tell you what the severity of your grades are. So if you've been injured and if you've been told directly or indirectly that you only have a grade 1 injury and you're not recovering at the speed that a grade 1 injury should recover at, you might have a different one. You should probably get examined, have the appropriate imaging, and try to get a more appropriate diagnosis. Thank you for watching this video. I know you have a lot to pick from, and I'm honored that you chose this one. And until we meet again, have a blessed day.